Welcome back to Bluebonnet News Headlines and Heartlines. I am your host, Vanessa Brazier, owner and publisher of Bluebonnet News. Today's guest is someone whose impact most people may not fully see, but thousands of families across Liberty, San Jacinto, and Polk counties have felt it. For more than 20 years, Steve Racciato has served as the executive officer of the Health Center of Southeast Texas, helping shape what healthcare looks like in some of our most rural and underserved communities. Under his leadership, the health center started out with one clinic in Cleveland and now has expanded access with multiple clinics across 3 counties. The clinics have strengthened services and stood as a critical lifeline for patients who might otherwise go without care. As a federally qualified health center, their mission goes beyond treatment. It's about access, affordability, and making sure no one falls through the cracks. Now, Steve is preparing to retire on May 1st, and he's going to pass the torch to his longtime Chief Operating Officer, Maggie Estrada. So we're going to take a moment and reflect on his journey, the challenges, and the legacy he's leaving behind. Steve, welcome to Headlines and Heartlines.
Thank you for having me, Vanessa.
You've spent more than 2 decades leading the Health Center of Southeast Texas. When you look back, what are you most proud of?
The fact that we've been able to grow to as big as we are. When we originally started, I never foresaw the need in the area and our ability to respond to it, to grow to the clinics that you've already mentioned, covering the entire areas of Liberty, San Jacinto, and Livingston counties.
Polk County.
Polk.
Yeah, Polk County. Livingston and Polk County, yeah.
Thank you. But those are where some of our locations are in those towns. So that's the thing that I reflect on the most, being able to have attained that. And we are now right in the middle when it comes to size with respect to the federally qualified health centers in the state of Texas. We are slightly above the 50th percentile right now. So we've experienced considerable growth in the time that we have been on operation.
So can you give people a little bit of a history? I know I reported on it recently when y'all hit the 20th anniversary, but can you tell people what year you started? And you started in a flower shop right here in Cleveland.
Right. We opened our doors in January of 2006, and that first year was definitely exciting. There were only 4 of us at the time. In addition to myself, there was Dr. Suleiman, the lady who eventually grew to be our COO, Maggie Estrada, and a person who was running the billing and collections for us. Her name was Janet Jackson. She's long since moved. Her husband is in the oil field business, and he had to go to places like Colorado and Wyoming for the booms that were going on out there, and she followed him. But we managed to survive the first 20 months without any federal funding, and that's part of the challenge you have in becoming a federally qualified health center, because the government doesn't give you the money to operate until you can prove that you can operate on a very limited budget. And so that was very definitely a challenge those first 20 months, and then we had finally submitted our application to become a federally qualified health center, and we were awarded that on September 1 of 2007. The official notice came out at the national meeting of the Association of Community Health Centers. This is the National Association of Community Health Centers. They were holding it in Dallas that year, and I was at the conference when my cell phone went off, and it was my project manager from the Texas Department of State Health Services advising me that she had just received notice that the Health Center of Southeast Texas had been awarded a grant. And it was funny because it was announced at that conference that I was attending, but unbeknownst to me, when the Secretary of Health Resources and Service Administration from Washington made the announcement, she said she was there and was going to announce an additional 40 awards. Unbeknownst to me, we were one of those 43 awards. And so my project officer told me to get online, which I did, and sure enough, there was the announcement released by the Health Services Administration, and our name was on it. So once we reached that, we knew that we had, financial backing, and we would be able to proceed without being too worried about where the funds were coming from, and we grew from there.
Okay. So for people who may not understand what a federally qualified health center is, can you explain in a nutshell what that is?
Yes, it actually dates all the way back to when the Medicare law was first passed in 1965. As part of that, the federal government decided that they were going to open up 2 clinics. One of them was going to be up in the Boston area, and the other one was going to be located in a place called Mound Bayou, Mississippi. And those 2 clinics were the first federally qualified health centers. There was a special set of laws written to cover how those organizations were going to operate, and they were going to receive federal grant funds to help them as they met the challenge of the directive, which is you will provide primary health care services to all patients regardless of ability to pay. Now, it doesn't mean that it's a free clinic, and HRSA, Health Resources and Services Administration, make sure that you understand that there is insufficient funds in the grant to allow you to operate as a free clinic. And they make sure that you pay attention to what funds you can collect. They allow you to charge a nominal fee, let's call it that, and you determine what the nominal fee is. Certainly an organization working in New York City is going to have a much higher nominal fee than we do. I believe ours is currently $35. And
it's income-based though, right?
It's income-based entirely. Yeah. And you have to be within 200% or below of the federal poverty guidelines to be able to access the discounts that you would experience in a federally qualified health center. But back to the original question, how federally qualified health centers came to be, it was that original legislation, which was part of the 1965 Medicare Act, that allowed them to come into existence. And since then, the government has periodically, over the years, opened up additional clinics. The grant is called a new access point. The government will make an announcement, and they'll announce that they are in the process of expanding the system. And currently there are 1,300 and I believe it's 72 organizations. It might be 1,375 throughout the United States. They supply care to the population, about 13,000, 14,000 clinics throughout the United States. And last year there were over 33 million people who received care at the federally qualified health centers throughout the United States. So this is how the program came to be. We were awarded our grant when they made the announcement. The announcement came out in 2006. We made the application, and then in 2007, after they had reviewed the applications that came in, we were one of the ones that were fortunate enough to receive a grant.
Okay. So I'm looking at this map behind you. This map in your office has been here since as long as this facility has been open. And I've always remarked, and you've got pinpoints in it. People can't see this, but you've got pinpoints of all the clinics, and then you've got these green areas and blue markers. What are those designating? Are those areas that need clinics or areas that...
No, let me describe this. So when we opened up, I was not a native of the Cleveland area. I was living down in Bel Air, Texas at the time, and I knew little about the area. So when I had to embark on making this clinic operational and functional, and we had not received our grant yet, I needed to understand what the area looked like and what the challenges were going to be. I went to a map maker down in Houston. I got this map made. It's a combination of 8 maps, which come from the U.S. Geological Survey.
It's about 8 feet tall. maybe taller.
It measures something like
Like 6
6
feet
foot
wide.
6 by 7 feet, something like
It's
that.
big.
It's big. And what it does is it gives me the population centers, and it also gives me some of the barriers to care that you would encounter there. The areas you're looking at with the the green and blue flags on them, the green indicates a national forest.
Oh, okay.
And that indicates that there's going to be very little population development there.
Okay.
The blue indicates rivers. And those things present barriers because if you'll notice in Liberty County alone, there's only 3 roads that cross the Trinity River.
That's true. 105, 90, and 787.
That's it. That's all you got.
Yeah.
And so you cross at one of those points.
Mm-hmm.
And to get from the east side of the river to the west side, you have to make a trip. Sometimes it could be 10 or 15 miles just to get to the access point to cross the river. So that's what you're looking at there. And having this map in front of me, it indicated to me where we were going to need to go as we grew. And sure enough, the area was growing. I could see that as I was coming to Cleveland, they began to expand Highway 59. The first expansion occurred back...
North. Well, I guess that was Montgomery County.
Yeah, it was right around that time. It was somewhere around 2007 they started to build the road, and it expanded it from a simple Texas highway to a freeway. Mm-hmm. There were no overpasses at the time. There were cross intersections, but no overpasses. They expanded it from Kingwood all the way out to the end of Montgomery County. And then recently they expanded it when the Affordable Care Act was passed, and they made, no, actually it goes back to when Bill Clinton was in office, and he said he was going to expand through NAFTA the highway system to an interstate which would run from the Canadian border to the Mexican border. Yeah. That was implemented, but the work did not begin until the 2000 teens. So at that point in time, it got expanded all the way up to Cleveland. There was the expansion of Highway 99, the Grand Parkway in the Houston area. And when that opened up, that's when this particular area started to explode. And you've seen that through the growth of the Cleveland high school system, or this Cleveland school system.
Yeah.
You know, because I know that they've expanded from approximately 5,500 students maybe 10 years ago to about 13,000 students now.
Yeah.
So with that explosion in the population, you know, it became necessary to try to stay ahead of the curve and get clinics located in the regions where people were moving to.
I think the growth now has slowed down.
It's slowed down, but there's the development in what is known as Colony Ridge Terranos, which is still part of the Cleveland zip code area and the Cleveland school system. But in the southern part of the county, down southwest of Dayton, there is a huge developments going in down
River
there.
Ranch, yeah.
The city of Dayton has something like 26,000 houses slated.
And major highways that converge in the middle of town.
In the middle of town.
And it's such a nightmare right now trying to get through Dayton.
That's right. So that is what the map has been for me. It's been a guide. You know, this is what you're faced with. This is where you need to develop. And
all the red points are the clinic locations.
The red points are where the clinics are currently open. And the blue one is where there's going to be a new clinic opening as soon as we can recruit in providers for it.
So let's go through it. We've got Livingston, right. Shepherd, Cleveland, Dayton, Plum Grove, and who am I missing?
Liberty.
I forgot Liberty.
Okay.
And then that's the next one that's coming in.
Yeah.
And that's going to be in the Roman Forest area, right?
It's actually right in the town of Roman Forest, but it will be servicing that New Caney area as well, and all the growth that's growing in there. And as you are probably aware, there are currently 4 elementary schools right in that area. There's the one, which is in Roman Forest itself, but there is a second one in Roman Forest in their development on the west side of Highway 59, that new development there. There is in Splendora, you have the Peach Creek Elementary School, which recently opened, and then you have the schools going in at. There's actually 2 in Roman Forest.
2 elementary schools?
There's 2 elementary.
I didn't even know
schools.
they had enough space for that.
They do.
I remember when that area flooded, so I wasn't sure. I guess just around the creek floods, but
no. In Roman Forest itself, there's 2. There's one very close to the clinic. It's probably within 500 yards of the clinic. And then there is a second one in the second development of Tavola.
Okay.
Okay.
Well, where's this new clinic going to be?
This one actually at the intersection of Roman Forest Boulevard and Appian Way in Roman Forest.
So is it outside that flood area?
Oh, yeah. It's if you want to call it a hill, there's a rise when you get to Roman Forest.
Yeah, when you come in, though, you have to go through that creek area.
That's right.
And that's where it floods, where the park is. Mm-hmm. During Hurricane Harvey, it flooded pretty badly.
That's right.
But then when you got beyond that, you were okay.
Yep, and it's up there.
Okay.
It's at that intersection. It can't be more than, I'm going to say, 150 yards from where City Hall is located.
Okay, I know where that is.
Okay.
Yeah, there's some nice homes out there.
Yeah.
So, we've talked about how challenging it is to get doctors to come out here. That's probably one of your biggest challenges, would you say?
Yes.
Can you explain how difficult it's been for you to recruit medical personnel?
Yes.
And I know Jasmine Suleiman for those who don't know, Jasmine Suleiman is the medical director, and she was also Country Doctor of the Year a few years ago, and she is a force to be reckoned with. But you need other people to come in and be in support of that.
Yeah, she was not only Country Doctor of the Year. 2 years before that, she was named by the Texas Academy of Family Practitioners as the Doctor of the Year for them.
That's pretty impressive. Yeah, yes, she's very impressive, isn't she? He's putting a thumbs up.
Yeah. She came to us. She had been, before she came to us, an associate professor of family practice medicine.
Yeah.
At St. Elizabeth's Hospital up in New York, which is one of the teaching hospitals for Columbia College of Physicians and Services.
Yeah.
Physicians and Surgeons, which is one of the 8 Ivy League schools in the United States. And so she came to us from there. So she is a very well-educated individual. She did her residency at Columbia, and then she did her fellowships at Duke and North Carolina, which are also very highly regarded medical institutions in the United States.
And she is actually a medical doctor.
Oh, yeah.
Yeah. Okay, so tell us what the challenge is in getting more doctors here in our clinics.
Yeah, the biggest challenge you have is the limited number of doctors available, and people coming out of their residency training programs are looking for not only areas where they can practice, but also areas that are more inclined to be able to attract people of that education level and people of that income level. So they tend to go into your bigger cities and to areas because I don't know how many people are aware of it. The training program to become a physician is pretty intense. You know, first you have to go through 4 years of college and distinguish yourself as an outstanding student there. Then once you get into medical school, it's a very intensive training program. And then once you finish your 4 years of medical school, you have to do, in today's world, you really have to do a residency program, which is going to be at least 4 years of additional training. So after these people have been put through the grind, and during that time they are spending incredible amounts of hours, even though it's gotten better than it was in the 60s and 70s, it's still not unusual to see residents working 80 hours, maybe even 90 hours a week in their obligations to meet the demands of the patients that they see in their residency training program. It's rough. And so by the time they're done, they're like thinking, oh my God, I'm finally done with my residency. Yeah. I am now board certified. Once I pass my certification exams, I will be board certified. I'm board eligible when I finish the residency training, but then I can become board certified as well. And being board certified in the United States means you have met a standard. And pretty much anybody who's board certified, board eligible, they have demonstrated they are very competent, so you don't have to worry about anybody you see being less than necessarily qualified to treat patients. But that gets back to the point that once you've gone through all that, you want to be able to enjoy the fruits of your labor. And so usually smaller towns like a Cleveland, like a Livingston, are going to have difficulty attracting people in. And oftentimes it's not necessarily the provider, it's the spouse, because they too have gone through all this training and long nights and not much to do other than complete the residency. And they want to begin to experience the benefits of the sacrifices they just made to attain that particular level of competence in their field. And so that's what plays into it. And private practice can certainly offer more than an organization, which is seeing people regardless of ability to pay. And so they can make higher salaries that way. So that's, in my opinion, the reasons you are having trouble recruiting into the rural areas. And it's nationwide.
Yeah, it's not just here.
It's not just here. It's
but
nationwide.
As the community grows, maybe we'll be able to have the amenities that will lure them here.
Yeah.
So, what were some of the biggest decisions you've ever had to make as a CEO? Do they happen daily?
When you're talking about, there's daily, you just have to make sure the clinic is running efficiently, you're bringing in people, you're training them properly.
Yeah.
The biggest decisions, I guess I would have to say, is when do we expand and where do we expand to?
Okay.
And those have been tough decisions because you have to locate the clinic somewhere where it's going to be convenient for the population that's there. And those are sometimes hard decisions to make. You have so many different places because our area is so widespread. I mean, we cover about 4,500 square miles. That's a large area.
Yeah.
So with that in mind, you've got a lot to cover in the area to meet the demand.
I understand that because I cover the entire county and beyond. It's a lot of square mileage to have to cover.
Yeah. So I would say, as the CEO, those were my biggest decisions.
When to expand.
When to expand and where to expand to.
Okay.
Because I do realize that it's, it's not just the board of directors in the organization, it's the community as well. They're, in a way, depending on us to make sure that we're getting people into the area. And we do have about 20 providers who would probably not be here if we didn't exist. So that helps the area with respect to meeting the healthcare needs. Otherwise, you're going to have to go to Beaumont, you're going to have to go to Conroe, you're going to have to go to Kingwood. You're going to have to travel a pretty good distance to be able to access healthcare, especially since the hospital has closed.
So you said 20 providers. Are they all doctors or some of them nurse practitioners?
I think it's 16 mid-level providers, and that includes nurse practitioners and physician assistants, and then 5 MD level providers. That's Dr. Suleiman, and then we also have Dr. Henry, a pediatrician, Dr. Reshmi, she is a pediatrician as well, Dr. Escobar, who is our psychiatrist. So.
Got them all? Trying to remember if he got them all.
I'm trying to remember if I got them all. You're right.
But so there's 5 medical doctors and the rest are nurse practitioners.
Yes.
I guess you're including Jasmine as one of them.
Yes.
Okay. Have there ever been moments where you thought, I don't know how we're going to do this, I don't know how we're going to get through it, but you did?
In the early days before we got the grant, unquestionably, you have to be able to pay your salaries, and we fortunately were able to have the hospital, and at the time it was Cleveland Regional Medical Center, and at that time they were a part of the community health service, CHS, Community Healthcare System.
Okay.
Out of Brentwood, Tennessee. We had their backing for the first year, the first 12 months.
Because they wanted their emergency room cleared up.
Yes, because of the losses they were experiencing by people making use of the emergency room for their primary care, which they couldn't afford. But
it's more expensive.
Due to the EMTALA law, hospitals at that point could no longer turn them away just because they couldn't pay. They had to treat them, stabilize them before they would be able to transfer them, and that was causing an awful lot of losses through the emergency room as these people were unable to pay whatever bills they incurred. So we went 12 months there, but during those 12 months I learned how to write grants. We got a couple of grants from the state of Texas, which helped us bridge the gap. And at one of the grants, we were able to bring in a second provider in our second year. And this was a physician assistant who was willing to work part-time. And what I came up with was a plan whereby the Dr. Suleiman, instead of working 8 hours a day from 8 until 5, I worked out a deal where she would work 3 12-hour days, and then the other provider would come in and work 2 10-hour days. And the added revenues we were able to get from having that second provider on hand, it wasn't much. We're talking about maybe $4,000 or $5,000 a month. That was enough to bridge the gap between what we were making and what we actually needed until the grant came through later that year in September, and we finally got the grant money from the federal government. So yeah, there were times when it was like, how are we going to make it to the next payroll?
Yeah, I'm sure it was stressful.
It was, but nonetheless, like I said, once we got that grant from the state of Texas, we were able to use that money to pay the salaries of the second provider and the additional support staff. And then the little money we were able to collect from the patients was sufficient enough to bridge the gap until we actually got the funding from the federal government.
What do you wish policymakers understood about these clinics?
Actually, Vanessa, I think that they really do understand it.
Good.
I think this is one of the programs that the federal government recognizes is beneficial to everyone. And so we do have some pretty good support for the program. It would be nice to be able to see them move away from other ways of meeting the needs of the unserved and underserved by simply expanding the program. It's already in place. It's proven to be a very cost-effective way to get care to the people who need it the most. And it comes at a relatively small cost to the government. I think the total amount that the government spends on the entire program throughout the United States is less than $20 billion a year. And you can say, well, $20 billion is a lot of money. Not compared to what they're spending money on other things,
Yeah.
which are not producing anything at all. The fact that we know that we're seeing over 33 million patients throughout the United States every year, and we don't have clinics that have nobody in them, let alone patients, as we've seen in other areas of the country for other programs recently. This is a very good program, and I think the legislature understands that. I have never experienced opposition to the program from anyone in the 20 years we've been in business.
So we should probably mention that this is not free health care.
No.
For most people, it's a reduced cost or income base, and you do accept insurance. You see patients from a wide variety of financial backgrounds, economic status.
The other thing we do for the patients is a lot of patients don't know what's available to them.
Okay.
They come from economically deprived backgrounds, and we can help them get onto programs which are available to them, and that helps out a lot. Whether it's Medicare, Medicaid, other programs that are specialized for certain illnesses and diseases, we can get them on that program. The other thing we have which helps out is our pharmacy, our in-house pharmacy, because it's funded using, it's called the 340B reduced cost drug program, okay? And what we can do is we can get drugs through the 340B program at a very reduced cost, and we can pass that reduced cost along to the people who need it the most. Once again, it's for the people who need it the most. If I come here and I get my prescription filled, it's going to go to my insurance company.
You'll pay whatever the rate would be anywhere, I guess.
Yeah, but nonetheless, the people who need it will come in and see substantial discounts. And I know that there's some drugs which are currently out there. One of them treats hepatitis C, which is chronic hepatitis. It's a very difficult illness to treat. And
the medications, are they expensive?
we're talking about the medication that they came out with recently to treat hepatitis C. It'll cure it, but it's going to cost, if you were to just pay for it out of pocket, on the order of $50,000 to $75,000.
Oh gosh, is that because the research costs so much that they're having to charge so much for the medication?
That's
Probably.
yeah. Because there are a lot of drugs which go into development that never make it to market. It'll reach a phase 2 or a phase 3 stage, and they will determine that the drug is not going to work. It's going to have unacceptable side effects, and so it can't be used. And so the research that is done on those drugs, all the funding is totally lost. So when they do get a drug that works, they have to be able to make it within a specified period of time, because after, I think it's 17 years, the formula for it can be manufactured by anyone.
Yeah.
And then it becomes a generic drug. So they have to make it up. But anyway, the people who are needing that drug can come in and get it for, I think it's less than a few $100s.
Yeah. Big difference.
Huge difference.
It makes it to where it's within range.
Right. And there's also another one which is used to treat diabetes. I think it's a once a day drug, and the cost to us otherwise would be $1,750.
Gosh.
But we can get it to the patient for between $50 and $75.
That is huge.
So it's a very huge savings for the drugs you need, because sometimes people will come to see you, they get the diagnosis, and then you prescribe the drug for them, and they can't afford the drug. So a couple weeks later, they're no better off than they were when they first came in to see you. So that's another key component we have here at the clinic. We can get those drugs to the people who need them at a price that they can afford.
How important are partnerships, like with the county, the cities, hospitals, nonprofits, to the success of this clinic?
They're an essential part of it. There's no question about it. We have been able to get grants from the state, from private foundations, from individuals, because everybody understands we've already got the funds and they know that we're going to succeed. So to give us money for, let's say, a piece of equipment or to help us construct a building, whatever it is, we have better access to those funds because we've already established that we are viable and we do have an ability to maintain that viability, and we're not going to waste the money of the organizations that give us the additional funding. It's very critical to have good relationships with your city, with your county, with your state, and with nonprofits in the area as well as nationally to be able to continue as a federally qualified health center.
You've built something that will continue long after you're gone. How intentional were you in preparing for this transition?
Can you say that again?
I said you've built something your legacy, you've built something that will last well beyond you. So how intentional have you been in preparing for this transition?
I think it's unbeknownst to most people who aren't in the program. One of the things HRSA does when they come in and they award you a grant, they're giving it to your organization because you were the one who wrote the grant and proved that there is a need in the area. However, if in the course of your administering the grant for the federal government, you prove to be incapable of doing so, the government reserves the right to pull that grant from you and re-award it. And I've actually seen that happen several times.
But not to you.
Not to us, but and what they do is HRSA will make an announcement, it will come out, you will receive a notice, and they'll say, we are rebidding this particular grant. If you want to apply for it, this is the area that it serves, this is what we expect, this is how much money you would get if you're awarded the grant, and they rebid it. And I've seen that several times since I've been in the business in the past 20 years. So that is one control that they use. The other thing with respect to planning is you are expected as the head of the organization to have a succession plan. Mm-hmm. We get an on-site visit from HRSA every 3 years. They send down a team of 4 people. They come in, they look at our books, they look at our policies and procedures, they look at how we're running the clinic. They will conduct interviews with our staff without us being present. They look at everything. They look at the board of directors. And then one question they've always asked me is, what is your succession plan and what is your vision for the future? And so that has been a requirement of the program, that you maintain a viable vision into the future to meet the needs of the community. Mm-hmm. And if you don't meet the needs of the community, as I've already indicated, they can pull your grant, but they can also allow somebody else to come in and put another clinic in your area.
You don't want that.
And we did see that locally in that, without naming names, there was an organization in a fairly rural part of Texas, but it was close to a city of moderate size in the $200,000, $300,000 population of that city. This organization failed to put any clinics in that city, and eventually somebody in the city came in and said, we're going to put a clinic in there. Mm. And HRSA was unable to
say no to it.
Yeah, to protect the rural clinic because they had never done anything to meet the demand of the city itself. And it was shown that over 95% of the low-income people in that city had no access to health care. So a big organization in the state of Texas came in with a plan to put clinics in there, and they took them. So you have to develop a plan that's going to make you move towards meeting growing demands in your area, and you also have to have a plan for succession. Who's going to be the next CEO? Who's going to be the next medical director? What is your board of directors doing to make sure that there is a continuation of people on the board of directors so that you have adequate oversight? And the board of directors has to be composed of a minimum of over 50% of people who use the clinic to prevent people who might not have a personal interest in the clinic being the ultimate authority for the organization.
What makes Maggie Estrada the right person to take your place?
Maggie has been with us almost since day one. She joined us 2 months into the operation having been opened. She has grown from a person she was originally a receptionist and a medical assistant. She already had attained qualifications to be a medical assistant in the clinics. She was certified. And from there, she has grown. She has gone and become, first she got an associate's degree, then she got a bachelor's degree, and eventually she got a master's in healthcare administration. During that period of time, she was just the logical person to promote whenever positions became available. So we moved her from originally just the receptionist and medical assistant. Then we moved her up to clinic coordinator. Then we moved her up to office manager. Then we moved her up to office manager of the entire organization at the different locations. And then eventually I was getting overwhelmed and I needed a chief operating officer to handle a bunch of the stuff I could no longer handle as we got bigger and more complex, and I just needed somebody to delegate that to, and she was the logical choice for that.
And she's handled it.
She's handled it superbly.
Yeah.
As of right now, she has actually been running operations for me for probably a good 6 or 7 years now. And she hasn't missed a beat. She knows what's going on. She knows how to react. She doesn't come unglued when things get tough and hard decisions have to be made. She's very knowledgeable. And so that's why she is the one who is most suited to be the next CEO of the organization.
When you think about your legacy, what matters most to you?
It's nice to have built something for a community that needs it. I know I'm not from Cleveland. I grew up in Pennsylvania. But the area I grew up in Pennsylvania, in a lot of ways resembles this community.
The rural part of it?
It's a rural part. The towns, like I look at here, we've got 3 towns in Liberty County. We got Cleveland, we got Dayton, and we got Liberty. Well, where I came from, we had 3 towns. There was Bangor, there was Rosetta, and there was Penargil. And, they didn't have much in the way of industry either. A lot of the men in town had to travel large distances to be able to earn a living. There weren't that many providers in the town. So, you always had trouble, who's open today, who's not? Where can I go get care? And we certainly didn't have a federally qualified health center there. So the fact that I am now in Texas and I don't have a desire to go back to the cold of
Pennsylvania.
Huh?
I'd love Pennsylvania. I haven't gone there in the winter, though. I do love Pennsylvania, though.
I prefer these summers to those winters.
Yeah.
That's why.
I can see that.
So having been able to do something for a community that needed it is what I am most grateful for having been allowed to do. I've had the support of the board of directors. They've been very supportive of me, allowing me to do the things that I felt were necessary for the growth of the clinic. And that is the legacy I hope to leave behind. I hope this place is here long time from now, and it becomes a vital part of the community.
And we talked yesterday briefly about you have a long list of things that you plan on doing in retirement. You're going to be doing some traveling, but you got a lot of projects around your house.
Yep.
That's what you plan to do.
Initially, yeah, and I figure it's going to take me at least the summer, if not well into the end of the year to get the projects done around the house that I want to do.
And then after that, maybe some traveling.
Definitely do some traveling then. But
With
then,
your wife?
With my wife. Mm-hmm. She actually retires tomorrow.
Oh, that's wonderful. You're both going to be retiring at the same time.
Well, we planned it this way.
Yeah.
I kept working as long as she was working. She's 5 years younger than me. She turned 70 on tomorrow.
And what did she do?
No, she turned 70 last week. I'm sorry.
What's her profession?
She started out as a geologist, but, we had children. She left the workforce during that period of time. And then during that period of time, she went back to school. She got accounting degree, but she never really did her CPA exam.
Okay. So she's been working as an accountant?
So she's been working as an accountant, since the kids had gotten old enough. And the kids have been out of the house now for 15 years. My youngest, he just turned 35. So she's been working quite some time, as an accountant for some organizations. And her most recent job, she's been with them for 11 years. And she's been their tax accountant. And she's done a lot of work for them. And they have many operations throughout the United States in many different states.
And her name?
Sue.
And so it sounds like retirement's going to be busy for y'all, but it's going to be fun.
Yeah.
So we end these interviews with fun, rapid fire questions, and you just have to give me like a short answer.
Okay.
Short answers are very hard for him because he has a lot going on in his head. What's something that most people get wrong about healthcare? A short answer.
You have to take care of yourself.
Okay, that's true. One word your staff would use to describe your leadership style.
Jeez. Involved.
Okay. A moment that made you laugh in a job that can be very serious. He's had some funny ones, y'all. He came dressed as what was this? You came dressed as a
Al Capone.
Al Capone to a chamber luncheon, and he was a complete hoot during the whole thing, making everybody laugh because he took on the role.
Yeah,
that was probably one of your funny moments.
Probably.
Yeah. If you weren't in healthcare, what would you be doing?
I'd be an engineer. I was originally an engineer before I got into healthcare.
What's one habit that helped you stay steady over 20 years?
Focusing on what's important.
Okay. All right. Best advice you've ever received? That's a hard one, isn't it?
It's what you make of it.
Life is what you make of it?
If you don't go out and get it, don't expect it to get delivered to your door.
That is good. That's very good. Who told you that?
Many, many years ago when I was first starting out, and I was in high school, and I was working my very first job with a guy, in our community.
And that's what he told you?
He was the one who told me that. He said, Steve, let me tell you what.
Yeah. Yeah. So what's something people would be surprised to learn about you? Do you have a hidden talent or hidden skill?
I would have... My vision is extremely poor, but from the time I can remember being alive, I wanted to be a pilot.
Oh, you like to fly? Yeah.
Well,
but your vision would not support it.
When you're 2 and 3 years old, you don't know if you like to fly.
Yeah.
But I was fascinated with flying.
Yeah.
And I would have been a pilot if I didn't have... My vision went by the time I was 8 years old. And I knew at that time I was going to have to give it up.
Yeah. What are you most looking forward to in retirement?
Oh my God, not having to get up at 4 o'clock every morning, not having to work until 8 o'clock at night. That's what I'm looking forward to.
Yeah.
But
slowing down a little bit.
Slowing down a little bit, just being able to say, it's somebody else's responsibility now.
Yeah. Well, Steve, I want to say thank you for your leadership and your vision and doing this for our communities.
Okay, thanks a lot.
Thank you so much for that. And thank you for coming on the podcast and sharing it with us.
That's okay. It's definitely been it's been a challenging, but it has also been an exciting 22 years, because I learned about this. It was about this time back in 2004 when I found out that the hospital really didn't hire me for what I was doing at the hospital, but I was hired to bring this into existence.
And you did it.
And I did it,
And we've known each other now for what, 20 years?
Probably,
around
at least.
20 years, yeah.
Mm-hmm.
Well, to my listeners, thank you for joining me for another episode of Headlines and Heartlines. I hope to continue bringing you the stories behind the headlines and the people who are at the heart of them, just like Steve. Until next time.